Hey, happy Monday, Decatur. Talk about a busy week last week. We're so thankful for the vaccine coordination efforts made by Decatur Morgan Hospital, the Alabama Department of Public Health, and then Payless Pharmacy, who is also administering the vaccine. I'm happy to report that our cases appear to be slowing down slightly. There is hope, but we must always have a strategy and continue to practice the health and safety tips to prevent the spread. And not to be Debbie Downer, but while our cases do seem to be slowing down, sadly last week we saw more deaths than any time since we've been in under the virus. Today we have with us Decatur Morgan Hospital President Kelly Powers. Kelly, thank you for joining us again today. And then Alabama Department of Public Health Assistant Administrator for the Northern District, Michael Glenn. Michael, thank you for coming back and joining us today. So we have a lot of data as it relates to numbers, and I'm going to let really Kelly and Michael share that. But I want to talk about briefly just the difference that we're making as it relates to being able to administer the vaccines, and the way that residents that I've visited with are thrilled to be able to say, hey, I got my vaccine, and I maybe a little soreness in my shoulder, but that's all that I'm hearing. Yeah. So, if you look at the fact that y'all are able to give 300 in a day, your goal is 300 in a day. 500. 500 in a day. And then we have Payless at 300. I mean, we're pushing out almost 6,000 vaccines a week. And now I'm hearing that if we can receive more product that's getting vaccines in.
That's the challenge.
That's the challenge right now. So if we can get more product in, then we have ways of, we know we have other providers that want to get involved. Yes. So we're encouraged about that. Then last week on a call, or actually a press conference with our state health official, lead health official, Dr. Scott Harris, he talked about the rollout of a website that would allow residents to register on the website as opposed to loading up on one phone line.
Yes, sir.
And we're encouraged about that. So to give you some idea of a timeline regarding that website, we hope to see that next week.
We do. We anticipate the first part of February, hopefully next week.
Okay. So with the city, we've been working with our faith-based organizations and trying to have a coordinated effort to be able to reach out to those that may not have access to a website, where they can reach out to our churches, and our churches will be staffed where they can take your information over the phone and then enter that information into the web portal when that time comes. Mm-hmm. And really what we're gearing up for is while we're in this period of the 75 and older, and then that next group, it's whenever these groups start getting much larger. And so we'll be ready as a city, and we want to be the leader in that. And I'm thankful for our faith-based organizations and everyone who's trying to help. So Kelly, if we could get an update from the hospital.
Yes, I am happy to report that our numbers are down. We have 52 positive inpatients, 6 presumptive inpatients, 12 in ICU, with 12 on the ventilator. And those are some long stays, sad about that. Currently, we're still full in our ICU. We have 19 patients, so 7 of those are non-COVID, or at least not positive at the current moment. I think I've talked before about you might be positive at one point, but come back negative and still have some underlying health conditions and things going on. Our employee numbers have come down. We have 14 positive and 23 self-quarantining, so that has been a really good thing for us. We're still seeing a fair amount of spread in the community as far as people coming to the emergency room that are positive. So still trying to manage that. I still want to make sure that people understand the monoclonal antibody infusion and what a great thing that is. I think all 3 of us have either family members or personal experience with that. So if you are 65 or older, you automatically qualify. But it is infusion, and you need to get an order from a doctor to have it done. But we're seeing great results in that and keeping patients out of the hospital and helping them recover. So again, thankful that our numbers are coming down some.
Absolutely. So I can't recall if I shared how the monoclonal infusion. I did receive that from my physician because of a lung issue. You go into the hospital through the ED, the emergency department. They register you, then take you up to an actual hospital room.
Yeah.
You have a choice of laying down or sitting in a chair. They don't mix the infusion until they see the whites of your eyes, and because it's it's a lot of very valuable infusion. Product.
Yeah.
It takes about 30 minutes to prepare that. They take your vitals, and then you receive the infusion, and that's about an hour-long process. And then you stay for an hour just to be observed to make sure there's no reaction. And then you go home. It's that easy. I never felt a thing other than I felt good after the fact, and as far as symptoms are concerned. So I encourage everyone to take advantage of that. So Michael, what about an update from the health department?
Well, thank you for allowing us to be here today. It's good to be here with some positive news today. Our total number of hospital patients statewide, it continues to decline, which is a good thing. This weekend it was up to 2,254, which is a lot less than our all-time high. It's still a lot of people in the hospital with this virus at this point in time, but the numbers are trending down, so that's always a good thing. Our numbers locally are also trending down. The positivity rate over the last 14 days has been hovering around 18.8%, which is still very high, but it's better than our all-time high when we were in the 40s and 50% range, so that we're thankful for those as well. North Alabama as a whole, we have 12 of our counties. 6 of them are in a low risk category and 6 of them are in a moderate risk. So we are definitely trending in the right direction. We want everybody to please continue to continue to do the masking, the social distancing, and the hand hygiene until we get more and more people vaccinated. Last week we had a very successful week. It's a very rewarding week to see the number of people that came out and we were able to vaccinate here locally. It was a little over 1,600 Morgan County residents that got vaccinated last week, and as a district we vaccinated at the health department a little over 14,000 last week, and so that's wonderful to see those people that are in that vulnerable population coming out and being vaccinated. And it was by far a community effort. We could not have done it without Decatur City Police Department being there, Morgan County Sheriff's Department, Decatur Fire and Rescue being there to help with traffic flow and those kinds of things. The citizens that came in last week, it was just a joy to be around everybody. They were in good spirits. People were kind. They were patient. And our staff is very appreciative of that. We have received numerous emails and just thank yous for the way that stuff has gone. And we appreciate the people that came in and just the positivity that everybody's doing. And so we look forward to getting more and more people vaccinated. Again, as we've already talked about this morning, the amount of vaccine that's available to all the providers is limited, and so that's our biggest challenge right now, is continue to stay in vaccine. We've got enough vaccine at the health department probably to stay through this week, a full schedule through the week, and we anticipate getting another shipment tomorrow. And so we hope that vaccine supply will continue to stay open, and as it continues to get better and as more providers come online, then we can definitely vaccinate more people. I heard a report this weekend. Dr. Fauci says that Johnson & Johnson is very close to being giving emergency use authorization for their COVID vaccine, which is a wonderful thing. It's a 1-dose shot. He says that he anticipates that over the next couple of weeks. So hopefully February is going to be a wonderful month as we get more vaccine availability and get more vaccine in arms, and as people are starting to get the second doses, we can get some coverage to our most vulnerable population, and we can move forward with some more things. And so, Mayor, thank you again for the support from the city, Chief Allen, and Sheriff Puckett. We just could not have done this without the community effort, and we just appreciate everybody that's being patient with us as we move through this challenging time.
It is. Thank you, Michael, and it is encouraging to get the feedback from those that have received the vaccine.
Absolutely.
They're just thrilled. I received a call from my mother last night, 82 years old, and she wanted me to know that she received her vaccine on Friday.
That's wonderful.
So she was thrilled about that, and she had a little soreness in her arm,
Yeah.
but other than that, And that's been the primary.
That's the primary thing that we hear is a little soreness about 24 hours after the injection, a little soreness around the injection site, and that usually goes away in about 24 hours as well. So I would much rather have a sore arm as have to be Kelly and her folks taking care of me at the hospital. So I'll take a sore arm any day.
Ibuprofen will help.
Absolutely,
Yeah.
absolutely.
It'll go a long way. All right, so Madison, we'll start with you. You're here behind the scenes
Yes,
with
sorry.
WAFF. Do you have any questions?
I guess my first one, it seems as though the answer is yes, but had obviously the rollout, the product being available has been the biggest issue, like you guys have said, when it comes to administering the vaccines. Has it been consistent though, day by day, as of right now, the amount of product that you guys are getting?
We usually get a shipment once a week on average, and so that has been fairly steady so far. That's not been the case with every healthcare provider, and so, but ours has been to this point. Now, going forward, it may be different, but up until this point, it has been fairly steady.
And then, I know you talked about, hopefully launching the website thing where people can sign up to get their vaccine that way instead of calling in.
Yes.
Obviously, there's been a lot of issues with that. I know that Judy mentioned last time, you guys, would consider doing the whole walk-in thing.
Yes, Morgan County is definitely doing the walk-in, first come, first serve this week until the website gets up. Hopefully the website will help alleviate some of the waiting times, but there's not been a great deal of waiting times at the local health departments. The flow has gone very well, and so this week it will be walk-ups, but hopefully as the website comes on, it will be even more smooth going forward.
Awesome. And then, last thing that I want to ask, do you have any idea whenever you guys will be able to start vaccinating that next group, the 65 and older?
It depends on the vaccine coming out. You know, we want to get vaccine in arms as quickly as possible, and when we're limited by the amount of vaccine that's available to that 75 and older category and healthcare and first responders, that is a huge group. And then when you open it up to the 65 and older, that's just going to exponentiate the problems that we're going to have, and it's all about the vaccine right now.
So does the vaccine come to us from the feds or from the state?
Well, it comes from the federal government, but it comes straight to us. It comes to the state as an allocation. The state then allocates it out to the communities and each providers based on population and risk factors of that way.
Okay.
Yeah.
Very good, very good. Brad, do we have anything?
Lauren Layton from WH&T asked, how is staffing when it comes to disseminating this vaccine so far, and do you anticipate more hires? And I don't know who that would be to.
Well, we're using some volunteer nurses, and I know they're going to get tired, so we're trying to get, a plan for longevity, so that we have some dedicated staff. I had somebody ask me the other day that their license had expired, their nursing license. And right now there's a waiver that we can still use them if their nursing license has expired. So if there's other people that would like to come back and work part-time, that would be great, and probably with the health department as well.
Same with us. If we are currently using our staff and retired state employees and things of that nature, but we also have hourly positions that are available for not only nurses, but also for clerical staff as well.
So I was on a call with Alabama mayors a week ago, and that applies to physicians as well?
It does.
Okay.
Yes.
Okay, so retired physicians, there's a waiver. I guess that was part of the governor's original order.
Yes, sir.
Okay. Anything else, Brett?
I don't know if y'all cover this, but she said, how many vaccines have you given out to date?
I didn't hear you.
How many
Coming up to
vaccines have you given out to date? Did y'all cover that?
North Alabama last week, the health department gave out a little over 14,000 last week in North Alabama. We gave out 1,603 here locally in Morgan County. That's just the health department and not the hospitals. Of course, they gave out a good bit more. And so last week was a good week as far as getting vaccinations in arms.
We have 250 appointments today, but we're trying to do 300. As Michael mentioned, the supply, we will run out. We still have only received our one allocation of 1,800, so we're trying to get more. We put in orders the week before last week, and we'll put in another order this week, and we hope to get some maybe this week to continue with the appointments, but through tomorrow we will run out of what we have. So, but we're trying eventually to get up to 500 a day. That's our goal.
Okay, so to the question, so we have these two providers, and then we have Payless Pharmacy located on 7th Avenue Southeast across from the Decatur Morgan Hospital. And they're a vaccine site, and I think it was their goal to try to do 300 a day as well. But it sounds like they may be out of product now. Is that?
I heard Payless was out.
Yeah, my
Another
understanding is
pharmacist
that
told
they
me.
have utilized their first allotment of vaccine for first dose.
Okay, so we're just waiting for replenishment,
Mhm.
Yes.
then we'll go from there.
That's all.
All right. Well, very good. Well, I'm thankful, I'm grateful for our guests today and the many hours of work that our healthcare partners have invested in health and safety of our community. Please help by continuing to wear your mask, sanitizing, and social distancing. I know you're tired of hearing that, but that's what we need you to do. So we've come so far. Let's keep running this marathon together. We'll have our next press conference Monday, February the 1st at 10 o'clock. And be safe, stay well. See you then. Thank you. Thank you all.
Thank you.
Thank you, Mayor.